Hi, I'm Dr. Bhargav Rao from Pathofast Lab Pune. Did your HCV total antibody test come out as positive or reactive, but your RNA PCR test is negative, and now you're completely confused as to what this means? So let's begin with what are the different types of tests for HCV, what is HCV, and what do these tests actually help us to know? HCV is a viral infection of the liver. It gets in through contaminated blood or body fluids. The tests that we use to diagnose HCV are almost all exclusively blood tests. These include tests like the total antibody tests for HCV, which you already did, or the IgM antibody test, which is a specific test for recent infections, the HCV RNA PCR test, the HCV RNA viral load test, and the HCV genotype tests. All these tests are basically done to either know whether you have the virus, whether you were exposed to the virus, and what is your current status with the virus, that is, what is your viral load. So the overall idea is this: the antibody tests only tell us whether you were exposed, whereas the RNA PCR tests tell us whether you currently have the virus. So coming to the antibody tests, this is basically called the anti-HCV total antibodies test or the anti-HCV IgM antibodies test. You may have had one or both, and either of them or both of them could have been positive. Now, these antibodies are only produced when our body is exposed to the HCV virus. There's no other situation in which these antibodies could be produced and show up in your blood. So the HCV antibodies are usually things that last for almost your entire life. Once you're infected with the virus, these antibodies are probably going to show up all throughout your life or for a very long period of time. They don't really help in fighting against the virus except for a very small proportion of them. All they tell us is that you've been exposed to this virus at some point in your life. The IgM antibodies are only going to be positive for the initial period after infection, maybe for the first 6 months or so, but the total antibodies will probably be positive throughout your life once you have been infected. These are measured through blood tests in the lab. Now, what is the HCV RNA test? Well, it's a simple test that checks whether the HCV RNA, which is just like we have DNA as humans, the HCV virus has RNA inside it, and this RNA test just checks whether it can find any trace of this HCV RNA in your blood. Why is it important? There is absolutely no situation in which the HCV RNA can get into your blood if you don't have the virus. So the HCV RNA is what is used by the virus to replicate, to make more copies of itself, and to generally get a hold in your body or in the host. So the HCV RNA, if present, it's almost conclusive, 100%, nearly 100% sure that you are currently infected with the virus. And that is why it is considered to be the gold standard. It is far more reliable, and its presence indicates that right now, as of this moment, the virus is present in your blood. There is no ambiguity when the RNA is present as to what is the status of the patient. So what are the possibilities? So we have a situation now where your antibodies are positive, which basically tells us, or we are led to believe, that you have been exposed to this virus at some point in your life. But the RNA test or the PCR test is negative. What does that mean? The PCR test being negative, like I already told you, means that there is no detectable level of this viral RNA in your blood right now, but the antibodies seem to suggest that you have been exposed to this virus at some point in your life, but we don't know when. So what are the three possible reasons? Number one is that it is a false positive antibody test. This is probably the first thing that you have to rule out. It can save you a lot of mental stress. Antibodies are false positive for all kinds of reasons. Everything from a mistake while collecting your sample, improper handling of the blood, improper storage of the sample tube, a problem with the analyzer that was used to process your sample, a problem with the reagents that were used in that machine, temperature control issues. There are n number of reasons because of which someone's antibody could come back as positive even when it is actually not so. I'm not casting doubts on the lab that you used to get this test done, but false positives happen all the time in every lab all over the place. Usually labs have systems in place to cross-check positive results. There are very few labs that will take a positive result for any antibody and just report it directly without cross-checking, double-checking. They have all kinds of systems that are used to make sure that they are not reporting a false positive. But be that as it may, if you have had this kind of a discrepancy where your antibody is positive but the RNA is negative, the false positive antibody is the first thing you want to look at. The second thing is that there is an active infection which is for some strange reason showing up as with antibodies but no RNA. I'll explain more in subsequent slides. And the third is that you have an old resolved infection which is probably the most sane reason for this finding. I'll also explain a little bit about that in the few slides to follow. So let's come to the first cause, which is the false positive antibody test. Now, what is a false positive? A false positive is when the analyzer or the lab equipment used to check whether you have HCV antibodies in your blood gives a positive result when you actually don't have those antibodies in your blood. That's why we call it false positive. Every single test system, every single machine, every single mechanism and principle by which these antibodies are tested will always have a little disclaimer at the bottom of the test kit saying that there can be false positives. Everywhere, it's mentioned everywhere. There isn't a single kit in the world that is used to test any antibody, let alone HCV, that won't have this line at the bottom. False positives are recorded in all kinds of different populations all over the world for all kinds of different diseases. Some of the most common causes are that you have an autoimmune disease like, say, rheumatoid arthritis, which is notorious for giving false positives for all kinds of other infections. You may have another viral infection at the moment, maybe something like a cough or a cold, which could be causing the same reagents to cross-react with your blood and give this false positive result. There are a whole host of other causes that could be producing this kind of a false positive result. You need to consult with your doctor and your lab. But what should you do? Well, the simplest thing is get another antibody test done at another lab where they are definitely not using the same machine or the same equipment that was used in the lab that you got your earlier test done in. This is the simplest and easiest way to sort it out. The second thing that you can also do is make sure that you're not taking any medications when you give your next blood sample, because medications interfere with lab test results unpredictably. The second but rather confusing situation is where you have very recently been exposed to HCV and it has produced some kind of an antibody response without the virus being present in enough numbers in your blood to show up on the RNA test. Now, this is a really rare and complex situation. We don't expect to see this very commonly because normally these RNA tests are extremely sensitive and they can pick up the smallest amount of virus that is in your blood. But be that as it may, this is a situation where the HCV virus has produced an antibody response, and so your antibody levels are positive, but the virus cannot be detected by the PCR or RNA tests. So what do you do in this condition? Get another RNA test done within a couple of weeks or a month. Obviously consult your doctor, and also get your liver function test done so that you can check whether your liver is also being affected or not. This is what you do if we suspect a very recent infection. It goes without saying that your doctor is going to ask you whether you were exposed recently, because if you had a recent infection in the very recent past, we are talking about less than a month back or 2 months at the outmost, you will have some kind of an history of an exposure. Maybe you are a person who works in a hospital, you have had an accident, needle stick injury, maybe you've had a blood transfusion recently from a source which was not properly checked, maybe you have had intimate contact with someone who has hepatitis C, but there has to be something that has happened very recently that can give us grounds to believe that you have been exposed to hepatitis C. The last, but what I consider is the most likely solution to this kind of complex result, is that you had hepatitis C at some point in your past, but it's been completely cleared. I mean, it's been cleared to the point where it cannot be detected from your blood. This is called a resolved infection. A resolved infection is when you may have had hepatitis C maybe 5 years back, 2 years back, 10 years back, and maybe you got treated for it, or your body was able to combat it by itself. I mean, in 25% of cases, the body does do that. And as a result of that, you show the antibodies because that's what your body produced to fight against the virus, but the virus is no longer traceable in your blood. So this is the most common situation where we will have a positive antibody but a negative RNA PCR result. And again, please consult your doctor. Your history is very important to know this. If you have a documented history of hepatitis C at some point in your past, well, then that fits. But you must consult your doctor, and at the same time you should get the RNA test repeated again to make sure that you're not having a relapse, and keep a close watch on your liver function test to make sure that your liver is also in good health.